The heart failure means the heart doesn't stop. It struggles to provide the blood to the body parts. Let us learn the heart failure in detail. By ACC and AHA 2017, that is American College of Clinical Cardiology and American Heart Association, and by NYHA, that is New York Heart Association. The definition of heart failure is: the heart failure is a clinical syndrome in which the heart is unable to pump the sufficient blood to meet the metabolic demands of the body and can do so only at elevated filling pressure. It is a complex syndrome that results from any structural or the functional cardiac disorder where the heart is unable to pump blood at rate sufficient to meet the metabolic demands of the body. Now let us learn the classification of heart failure. By ejection fraction, we have HF-REF, that is the reduced ejection fraction, HF-MREF, that is mid-range ejection fraction, that is 40 to 50%. HF-PEF is the preserved ejection fraction. By the onset, we have acute heart failure and chronic heart failure. By the output, we have high output heart failure and low output heart failure. By the side, we have left-sided heart failure and the right-sided heart failure or biventricular heart failure. The NYHA classification defines the heart failure as: the first symptoms that occurs in heart failure are angina, dyspnea, and palpitation. Mnemonic for it is ADP. Class 1, symptoms with more than ordinary activity. Class 2, the symptoms with ordinary activity. Class 3, where symptoms occur when less than ordinary activity is performed. And Class 4, symptoms occurs on rest. Main cause of it is LV failure. Now the types of heart failure are HF-REF versus HF-PEF, that is the reduced ejection and preserved ejection. In HF-REF, the ejection fraction is less than 40%, and in HF-PEF, the ejection fraction is more than 50%. HF-REF occurs in systolic dysfunction where the ventricles are dilated, commonly seen in ischemic heart disease, responds to GDMT. HF-PEF occurs in diastolic dysfunction where the ventricles are stiff. It is commonly seen in elderly patients with comorbidities like hypertension, diabetes, obesity, and the treatments are limited for HF-PEF. Key distinctions for HF-REF are impaired contractility, dilated and weakened ventricles, where the ventricles are dilated and unable to pump the blood to the body. In HF-PEF, where the impaired relaxation of heart occurs and thickened stiff ventricles are seen. Now the etiology of the heart failure. Most common cause is ischemic heart disease, where the people are developing MI, coronary artery diseases, hibernating myocardium is seen. Second most common cause is hypertension, where long-standing hypertension leads to the cardiac failure by the LVH, and LVH is left ventricular hypertrophy. Diastolic then systolic dysfunction occurs. Cardiomyopathy is where the dilated cardiomyopathy and restricted myopathy causes the heart failure. Valvular disease like aortic stenosis, mitral stenosis, aortic regurgitation, mitral regurgitation, tricuspid regurgitation cause heart failure due to the volume or the pressure overload. Other causes like arrhythmias, pericardial diseases, anemia, myocarditis, congenital heart disease are also seen. There are other causes, that is toxic drug induced causes due to the NSAID and other drugs. Pathologic hypertrophy, aging, beriberi, chronic anemia are also the other causes of the heart failure. The pathophysiology of the heart failure, where the cardiac insult occurs, causing the low output and increased filling of the ventricle, causing the hypertrophy, and the neurohormonal activation occurs, causing the ventricular remodeling. Clinical features and symptoms of heart failure are the left-sided heart failure symptom, that is dyspnea, that is breathlessness on the exertion. Orthopnea is the breathlessness on lying down, and PND is the nocturnal dyspnea occurring at night. Fatigue, reduced exercise tolerance, cough with pink frothy sputum. Symptoms of heart failure. Left-sided heart failure. The symptoms are for systolic heart failure are FFF, 3 cool SPN. F means fatigue, fainting, forgetfulness. C is cardiomyopathy, cyanosis, and cool extremities. O is for oliguria, organ dysfunction. L is for low BP. S is for S3 gallop. P is for pulsus alterans, and N is for narrow pulse pressure. These are all systolic heart failure symptoms. Now let us see for diastolic failure symptoms, that is mnemonic for it is do not fill. D is dyspnea. O is orthopnea. N is PND. O is oliguria. T is tachycardia. F is fatigue. I is increased filling pressure. L is lung congestion. And L is edema, light edema. These are the symptoms of diastolic heart failure. Heart failure. Most common cause of right-sided heart failure is left-sided heart failure. It occurs due to the increased right ventricular end diastolic pressure causes increased right atrial pressure, causing increased volume overload. The symptoms are abdominal, jugular reflex, ascites, hepatomegaly, edema, and increased JVP, jugular venous pressure. Diagnostic investigations for heart failure are ECG. On ECG we find LVH, arrhythmias, prior MI, and left bundle branch block. Echocardiography, where it is gold standard. BNP and pro-BNP are the key biomarkers, where those are elevated in heart failure Rules out are diagnosis for the heart failure. Cardiac cath and MRI, coronary artery anatomy, tissue characterization and viability assessment can be checked. The chest X-ray where cardiomegaly, pulmonary congestion can be seen or the pleural effusion. Other labs are the CBC, renal function, electrolytes, LFT, thyroids and iron studies. Treatment strategies for heart failure are pharmacological and non-pharmacological. In pharmacological, we have the ACE inhibitors like enalapril, ARBs like losartan. Uh, ARNI are the newer agents are used in primary management of heart failure. Other agents like ARNI are sacubitril and valsartan are most preferred. The beta blockers like carvedilol, metoprolol. MRA are the mineralocorticoid receptor antagonists where we use spironolactone, the SGLT inhibitors, and diuretics like furosemide for the congestion. Non-pharmacological management of heart failure are the device therapy like ICD and CRT. Lifestyle management in which we advise the patient to restrict the diet for salt and fluid intake and exercise. In advanced, we do the heart transplant and monitored on daily basis for the weights, BPs. If he is having diabetes, we will see the sugar levels and all. The most common in management is ACE, ARBs and ARNI, beta blockers, MRA, SGL2 and diuretics. In device and surgery, we have ICD, CRT are the most common, and lifestyle and monitoring, dieting, exercise, weight, BP, and remote telemetry. The mnemonic for management of heart failure is 4 plus D plus D plus T. 4 is the ACE, ARBs, beta and MRA. D is for diuretics. D is for devices and T is for transplant. The complications of heart failure are arrhythmias, most common, which can lead to the sudden cardiac death. Renal dysfunction can occur. Thromboembolism can occur, where the patient can undergo for the neural thrombosis, stroke, and hypercoagulative states. Cachexia, that is weight loss. The clear mnemonic is the mnemonic for the heart failure is failure, where the F stands for fluid overload, that is due to the diuretics or the salt restrictions. A is for ACE inhibitors and ARNIs are the first line drugs for the heart failure. Inotropes and the ICDs, loop diuretics, uric acid and MRA, that is spironolactone, reduced afterload, that is SGL2 inhibitors, vasodilators, and E is for education, exercise, and diet counseling. If this video has helped you, hit the like button and subscribe and share with your friends and subscribe for more. Thanks for watching.